So with that, I know that we have some questions that are queued up and ready to go. I'll pass it over to Dana, and she will be helping to facilitate the questions with the panelists.
Hello. First, I want to thank you all for submitting such excellent questions. We received a large number of questions both before the webinar and also they've been coming in through the Q&A, so thank you for that. But in the interest of trying to get as many questions answered as possible, I'm going to try to kind of combine similar questions. But the first one is for you, Commissioner. Can an organization that's in Anchorage or a non-rural area submit an LOI and be eligible for funds?
Dana, that's a great question. The answer is yes. Alaska has a hub and spoke healthcare system. And we know that non-rural areas, Anchorage, Fairbanks, Juneau, provide healthcare services to Alaskans living in remote and frontier communities.
Thanks. I'm also getting some questions for the Alaska Community Foundation. So if an entity is running into problems with the registration or the LOI next week, what should they do?
We actually have an email, rhtp@alaskacf.org for you to email, and we'll help you with any problems registering. And then remember that because questions that have to do with the application process and the grant process, that's really your way of getting a hold of us.
Thanks. And I just put that email into the chat for folks. Okay, so for entities that want to submit letters of interest for projects that maybe aren't quite ready to launch in year one, should they hold off for future funding cycles? That went to Deputy Commissioner Ricci. Oh, you're on mute.
Should they hold off for future funding cycles? I think it depends. We are trying to design a program that will support entities in identifying, in building out concepts that can support the needs, the future needs of the healthcare system in providing, better outcomes, more efficient care close to home, right? Those are the goals. And so if you have an idea that has community support and is maybe won't be ready for a few years, but you believe that it is valuable enough to begin starting that process now, I would consider submitting a letter of intent for that concept, right? Because there may be opportunities through readiness or planning to build that out further. But please be thoughtful about what you do submit, right? Make sure it is something that, again, aligns with the community needs, is a serious project, and aligns with the goals of the Rural Health Transformation Program.
Great. The next question is about the letter of interest. So Megan, is there going to be a word count or a character limit on any parts of that letter of interest?
Yes, there will be character limits on all of the text fill-ins, and I think that we're expecting the maximum to be around 2,500 characters, but that's per field.
Great. Okay, and then Betsy, there's a couple questions about timeline. So can you clarify, do projects for year one need to have all their funds spent by October 2026 or 2027?
Thanks for that question, Dana. I think the timelines are something that we're all still wrapping, that takes time to wrap your head around. So for the first year, we need to allocate our funds. We need to have a plan that we've communicated to CMS for how are we going to, across the state, spend these funds by October of 2026. That's to have the plan. We have until October of 2027 to finish spending those funds. So if you apply for and receive funds out of year one, you have through October of 2027 to finish spending that bucket of funds. Now, I know that folks are also looking ahead and saying, I have work that I want to do, and it may cross over multiple years. And I think, Alex or Megan, maybe you can chime in a little bit, but I do think we're going to be looking ahead with asking for the when we ask for the information, we want to know what your kind of proposed or projected future funding years are. You know, like I said, the state's going to have to go in and update our application with CMS every year. So we have funding for the first year, and then we'll have to go through that updated application process with our federal partners, and we'll see what the award is for the second year. There's some space for our federal partners to make adjustments to that. That's why we can't look ahead beyond this first budget period when we make solid commitments, but it's really helpful for us to know what are your projected future year funding needs, so that can inform our future planning process too. But Alex or Megan, I don't know if there's any additional context you'd like to add about that.
There will be a question. We'll ask very generally. We're not asking for in that first part where you're going to give like a very detailed budget. We're just saying, what are you thinking? What do you think you plan to spend this year? What do future rounds look like? And particularly if you're asked to put in a full proposal, we'll get more detail, and that'll really help the Department of Health anticipate, or project, what to ask for in future years.
Thank you. So a little bit related, but can entities submit different LOIs if they're across different funding pathways, or how should entities think about the number of LOIs that they're submitting? Alex, could you take that one?
Yeah. So an organization can receive funding for multiple projects. And they may be at different stages. There may be the project that people have been working on or organizations have been working on that's really ready, but you actually already have ideas. You might have something else that's sort of right up in the hopper that's really in the planning stage, or some idea that you're really starting to think about, and that's readiness. So you can definitely receive funding for multiple projects across different pathways.
Okay, thank you. So kind of riffing off of that, Commissioner, is there going to be a cap on the number of LOIs an entity can submit, or a cap on the total amount of funding that one entity could receive?
Yeah, that's a great question, Dana. I would say at this time, there's not a cap on the number of letters of interest that an entity can submit, or the total funding. But I would really say that you need to remember this is a 5-year federal cooperative agreement. And Betsy has done a really good job with outlining year 1, year 2, year 3, year 4, year 5, the timing. Year 1 is very short, it's very truncated. And so we are looking for organizations and their capacity to complete the work that they are proposing through their letters of interest. And so there's a capacity issue, and ensuring that that organization can follow through with expending those funds within the time frame. Because there is risk that if an organization says they're going to do a lot, they're not able to accomplish everything for a variety of reasons, and we're not able to liquidate those funds within that time period. The state is at risk, and we could have our funding award lowered, right, in the subsequent years because of overcommitment by any one agency. So that's part of the thought process with the Alaska Community Foundation, looking at the readiness of the organization and the capacity that they have to complete whatever project they are proposing. And remember, all of this is really focused on aligning to our goals, aligning to the initiatives and those proposed funding uses that Emily talked about at the beginning of this presentation.
Okay, and then Betsy, I think I'm going to kick this next question to you. So if there's a group of organizations that are partnering together to submit an application, how should they apply?
That's a great question, because I think that we've seen a lot of, we know that there are a lot of partnerships, strong partnerships across the state where entities are working together on these goals. And we've seen some new partnerships emerge, or also people saying, hey, I really have this idea. I don't think I can do it all alone. So I think What's helpful to think about when you're building out your letter of interest and building out your future applications is you need to think about who are you anticipating will receive those funds. So if there are multiple organizations that are partnered together and you each are saying, hey, we're working together, but we each need to receive some funds in order to move this project forward, then each entity would want to submit a letter of interest and then ideally a full application. I think we're going to be asking about partnerships through this process so that we can kind of link that on the backside and recognize, oh, these three entities are working together. We want to make sure we evaluate that as look at that as a cohesive package. But if you're an entity and you're saying, I know that I'm going to need to contract with a vendor, I'm going to need to hire somebody, I'm going to need to kind of, do that type of a relationship where you want the funding to come to you and then you'll go out and contract with a specific entity, that would be one letter of interest for the group or the entity that's looking to receive the funding.
Thanks. I think, Megan, I'm going to ask you this question. Do organizations need to have prior experience with managing federal grants to apply or submit LOIs for RHTP funding?
So no, applicants don't need prior experience with federal grants. We're going to be providing funding and technical assistance to help organizations build administrative capacity needed for the management of the grants and the implementation of the projects. One thing, though, that is important is that in order to provide the funding for those initial readiness and planning grants, they do need to be registered with SAM.gov. So that's one piece that needs to be in place beforehand to be able to offer the funding.
How should organizations be thinking about submitting an LOI if they have like a really early concept idea? What kinds of activities could be funded? And I'll give that one to Betsy.
I think kind of building on what Megan and Alex have shared already is that, if you have an early stage idea and you're thinking about, we need to build readiness within our organization, we need to, are we able to, accept and spend and report on, some of the uses of some of the federal funds. There may be resources that your organization needs to build up that capacity, but also, do you need help bringing partners together? Do you have kind of an early stage concept where you need to, get some assistance, putting some shape around that and assessing the feasibility and the practicality of your plan? Those are all the types of activities that could be funded through planning or readiness grants. But something to think about is that you don't necessarily need to identify in your letter of interest exactly where you think that you need to go. What we want to hear is your project concept. Where are you today? How do you see your project impacting the state and your community and moving towards the goals? And then, we may come back to you and ask some questions to help us understand the best fit for you, especially within this first year. So really don't worry too much about which pathway should I go after, where do I think I should be. It's really best if you can provide the information you have about your project, your concept, your partnerships, how far along you are. And then if you know that you're like, well, I really need some support in this area, if you can describe that to us too, that's really helpful.
Thanks. Okay. Still getting lots of questions about how, if there's an entity that's part of a larger organization, should they register separately or as part of their parent organization, use that same parent organization registration on ACF's website, and then submit separate LOIs? And then, Megan, while I've got you, I'm going to kick that question to you. Also curious, there was a slide where you talked about service area selection. How should organizations think about that? Is that the service area for their particular project, for their general organization? What if they service multiple areas?
Great. So I'll start with the first one. Generally speaking, you're going to want to register with the parent organization, and then separate LOIs for each project. As I touched on briefly in the presentation, there will be the opportunity to submit project specific contact information. And so if you have different people in different departments working on different LOIs, you will be able to reflect that when you are submitting the proposals. And so, generally speaking, you apply with the parent organization and just indicate the sub-organization or the department in the application. If that, for some reason, doesn't feel like it will work for your organization, reach out. And it may be a special case, but I would say 99% of the time you're going to be applying with the parent organization. Then the other question you had about service areas. There is the opportunity to indicate that you're multi-regional or statewide. And so we would ask that you reflect the regions that you serve, and there will be a later question that asks whether you are serving a single community within the region or multiple communities or part of a hub and, or if you're participating in a hub and spoke network where you're serving a wider network than maybe the particular community where you're operating. You'll have the opportunity to reflect that in the LOI.
Okay, thank you. So this next question is for Deputy Commissioner Ricci. So if there's a vendor organization that's outside of Alaska, should they submit an LOI if they're interested in partnering with an Alaska organization?
Yeah. One of the big opportunities, one of the many opportunities I see with the Rural Health Transformation Program is the ability to bring in ideas, concepts, technologies, workflows that maybe aren't utilized right now in Alaska, but could be adopted and implemented effectively by different Alaska-based organizations. And again, when we go back to the intent of the Rural Health Transformation Program for Alaska, it is support Alaska organizations and communities in ultimately improving the health outcomes in a sustainable and affordable way for Alaskans, right? So if you are an entity that has no connection to Alaska and is not connected to a community-based organization or a healthcare provider that is rooted here in Alaska, I don't know how you could effectively meet the need of Alaskans. And so we will be asking for some of those questions in the letter of intent to really make sure that as we look at different ideas moving forward, that those are tied to and deeply rooted to Alaska-based organizations and entities that are on the ground practicing and providing services to Alaskans today.
Thanks. And then Alex wanted to ask you, there's some questions just kind of wanting to reiterate the timeline around the portal and when organizations should expect to hear back. And also just sort of the process after an organization submits the LOI, who's going to review it, and when should they think about hearing back?
Well, as Megan said, the portal will be opening next week, really getting that pulled together. And then after that, the Alaska Community Foundation and the Department of Health have a process where we're going to be kind of preparing and reviewing the letters of interest together. And organizations should expect to hear about the next steps by mid-April when some of the initial grant making will start for the first two categories. And projects that are ready to move forward will be asked to submit a full proposal in March. And that's the timeline. Was there another part of that question?
Oh, I think you covered it.
Yeah, okay. All right.
Okay, so we've kind of touched on this a little bit, but I'm going to ask it again because I think there's still some benefit in clarifying. An organization that has lots of ideas, how should they think about sort of the totality of all of the letters of interest that they're submitting? Should they err on the side of submitting all of them as separate LOIs, or how should they be thinking about that? I'm going to give that one to Deputy Commissioner Ricci.
So Dana, just to summarize, I mean, if they have multiple projects, should they be submitting multiple letters of interest or intent?
That, and also how should they be thinking about the total portfolio of projects that they've submitted? Like, should they submit only the projects that they're able to actually, if they're able to actually implement all of them?
So again, I would think about the projects in the context of the people that you serve and what that looks like over the length of the Rural Health Transformation Program, right? So if you have some projects that may need to be built out now from a feasibility or a readiness or a planning standpoint, because they might not be ready for implementation until years 3, 4, and 5, I would consider submitting a letter of intent so that when we are aware of this, right? Because again, part of what we want to do is we want to help identify areas where we see partnerships or I hate the word synergies, honestly, but like parallel efforts that are occurring across the state or across different areas. So again, if this is a serious idea that you believe has merit and aligns with the goals for the community you serve in the program, but maybe a few years out, it may be appropriate to submit a letter of intent so that we are aware that you are thinking about this and there may be support for readiness or planning, right? And so what we're really trying to balance is like, don't throw all of the spaghetti against the wall and see what sticks. It really is, how are you thinking about these projects and these ideas within the context of the population and the community of Alaskans that you are trying to serve in order to achieve the overall goal? And we know that some projects are going to occur over multiple years, and there's going to be different phases within that. So thinking about submitting letters of intent that outline the different elements of those projects, but how they tie together as a whole is how I would be thinking about it. If I'm an organization that might have 3 different projects, one may not be ready until year 4, one may be ready in year 2.
Thank you. Is the state going to be prioritizing the projects that are implementation ready in this first year? I'm going to give that one to Commissioner Hedberg.
Yeah, Dana, that's a great question. And I've been trying to answer questions in the Q&A, but there's like there's 139 questions. So I would say, remember, year 1 is really short, right? There's a short runway. So it necessitates that we do need to prioritize project implementation, but we want to care for those agencies that need that readiness support or that planning support. So you are going to see a blend. Year 2 is right around the corner, if you remember that timeline. So be thinking thoughtfully again about what you are submitting. Do you have the capacity to do this amount of work in year 1, or do you want to spread out this work over that 5-year timeline? We're really asking you to really help prioritize what is most meaningful for you and your community. And if I may, Dana, I'm just going to add on. We are starting to have starting the conversation around regional planning that will start this spring. We've already heard from some communities that have already come together and they're starting those planning efforts. And I think that is going to be a really good guide to help all of you in community to identify where are you at? How can you improve your health outcomes? How can you strengthen your care delivery models in your region? And when you identify those gaps, how you can leverage the RHTP funding to address those gaps in those care delivery systems in your region or community. Again, so we have our North Star of Healthier Alaskans. all of this is predicated that we're also cognizant of sustainability, right? That we're thinking of sustainability. Back to you, Dana.
Okay. Kind of a follow-up question to the question about if we're prioritizing implementation ready. Are small projects as competitive as large projects? Are we looking for bigger projects? Let's do a speed round. Back to you, Heidi.
Great. Yes, I'm really good with the speed rounds. You know, we're looking at the entire state, and every community, big and small, has needs, and we're going to care for those communities to make sure that it's equitable across the state. Again, the focus is on our rural communities and how we are supporting our rural care delivery system. We know that it has a statewide impact. And so we're going to be looking at that process of that hub and spoke healthcare system, caring for our most smallest communities, our most smallest nonprofit or organizations, I should say.
Okay. Another quick question is, are there any organizations that aren't eligible? Like, is it just nonprofits that can apply? Yeah, do you have an answer for that one?
Yeah, I would say that all organizations are eligible, but we need to ensure that all organizations are following our federal guidelines. So as an example, we can't pay for lobbying. Individuals that want to have an individual project that's not an organization, they are eligible to apply, but that's not really the appropriate use for the RHTP.
Okay, great. I know we're getting close to closing here, so I want to make sure to ask this question. Can you clarify when the office hours will be and kind of what to expect during those office hours? And I'm going to go ahead and post the dates in the chat again.
Great. So for the next 3 Tuesdays, we are going to have office hours. It's not on our website right now. Give us some time so we can set up the webinars. We'll set up the registration, and you'll be able to register and participate.
Great. Well, just 1 minute left. Any closing remarks?
Thank you, guys. We've had a great participation in this webinar. Please keep the questions coming. We're going to aggregate those questions and post the answers on our website. We really appreciate all your thoughtfulness and interest in the Rural Health Transformation Program. Thank you for participating. Bye-bye.